What is the best solution for my puffy eyes? I'm 33 years old, female. I've had puffy eyes since I was 24. It makes me look tired and old. What is the best solution for my situation, and how much will it cost?
Thank you for your question. You're 33 years old and you state you've had under eye bags since you were 24, and you submitted two very good photos to clearly demonstrate how puffy the under eye bags are. And you want to know what's the best solution and how much would it cost. Well, as a cosmetic oculofacial plastic surgeon for over 20 years in practice in Manhattan and Long Island, this may very well be the most common procedure we perform in our practice. So I'm going to help you understand how we approach someone like yourself, and first let's understand the anatomy that we're dealing with. What is making the under eyes puffy? Well, the under eye bags are caused by something called lower eyelid fat prolapse. This is a herniation of fat. It's fat that's normally behind the eye that pushes forward and creates these bags. Why they happen at the time that they happen is generally a genetic trait. And so it is something that tends to run in families. I've operated on 3 generations in the same family, and certainly I've recognized this very strong hereditary factor. It doesn't always have to be an obvious hereditary factor. Sometimes, like the way people have hair loss, it can have variable expression at different times. But understanding that this is fat. Now, in our practice, we have a two-pronged approach to dealing with this. One is to deal with the fat pocket. So as someone who's in their 30s, we generally feel like you don't have extra skin. And this is a very important distinction. A lot of people will go to a general plastic or non-specialized plastic surgeon whose approach to lower eyelids is always to do an incision from the under the lashes, external approach, also called a transcutaneous approach. And very often they'll try to remove skin the way we remove skin on a facelift, and they'll find that the eyelid pulls down. And in a way, a lot of general plastic surgeons have done this so much that it's like a new normal that the eyes get rounded. Now, I'm not disparaging general plastic surgeons specifically, but I'm just saying that as a specialist, I've seen this in my practice, and I've seen this kind of a bit of a trend in the approach. My approach to someone like yourself would be something called a transconjunctival blepharoplasty. This means I'm working from the inside of the eyelid, and I'm addressing the fat pockets that have pushed forward without interfering with the skin and the muscle and the structure. The lower eyelid is actually deceptively complex. There's a balance of the tendon called the lateral canthal tendon, and the structure is called the septum and other parts that are very much important for lower eyelid position. We see patients from all over the world whose eyes get pulled down, who get rounded from complications of lower eyelid surgery, and considering that it's eyelid surgery is one of the most popular cosmetic surgical procedures, you can imagine what percentage of people have these issues. So that being said, there's another thing that we do that's a little bit different than what a lot of our colleagues do. We address skin quality, and skin quality can be addressed with modalities such as radiofrequency, as well as lasers such as erbium or fractional CO2 laser. That will help improve skin quality and any concern about wrinkles and the perception that there's too much skin when there isn't, but rather we have to distinguish quality of skin from quantity of skin. But in addition, we use something called platelet-rich plasma. Platelet-rich plasma is derived from your blood, and it's a concentration of the healing growth factors needed for when you have a cut. And we have found in our practice that we're able to really improve significantly the under eye skin with the platelet-rich plasma at the time of surgery. You know, the eyelid skin is only 0.5 millimeter in thickness, so you can't really put a filler under there. But platelet-rich plasma has been a really wonderful option for us to create this synergy of reduction of puffiness, addressing of fine lines and wrinkles with laser, and platelet-rich plasma for rejuvenation of the skin. We love it. We use platelet-rich plasma in the rest of the face and other parts of the body as well. But it's a combination approach. I always say that the whole is greater than the sum of the parts. We do these procedures under local anesthesia with light IV sedation or intravenous sedation. This means that you're relaxed because we're giving you a medication through a vein that is like a liquid Valium in that class, and it helps you not feel anything and be comfortable during this procedure, which typically takes under an hour to perform. So, with that being said, I think that your job now is to meet with doctors and meet with cosmetic surgeons, learn about their personal style and how they approach the lower eyelid bags. As I said, I would recommend the internal approach or the transconjunctival approach as opposed to the external approach or transcutaneous approach. And again, I do my procedures under local with sedation, and I avoid general anesthesia as much as possible. And then once you meet with the doctor, look at their experience, look at their results, get a sense of being comfortable with who they are, make sure the personalities are in sync and that you can really put trust in the doctor who's going to do your surgery. So I hope that was helpful. I wish you the best of luck. And thank you for your question.